for you two that don't know, I'm a chiropractor in Delafield at Lake Country Health Center, and I've done talks here. I don't know, I've done a handful of them. Last time I was here, we talked about the shoulder. Okay. And at that last clinic, I got some feedback from the trainers that they've seen some knee injuries as of late, or knee pain, people complaining of knee pain, and they thought it'd be a good idea to talk about that. So that's what we're gonna do today. I specialize in treating sports injuries. I see all types of athletes, so I work on shoulders, hips, knees. I do dry needling, shockwave therapy, and rehab. I've been doing that since 2012, so 12 years, which is crazy to think about.
It's just really
Okay. So I'm going to do this kind of like I did that last one with the shoulder, where we'll talk about the structures of the knee. We'll talk about common non-traumatic, so not ACL tears, but non-traumatic causes of knee pain that you'll probably encounter just from using your knees in the gym or in life. We'll talk about different movements in the gym and life that are knee dominant. So if you are currently having knee pain, these would be things to look to kind of modify or tell your trainer about so that you can find a different option. We'll go over the squat and the points of performance for the squat, because it is foundational to quality of life, but also in the gym. And then we'll perform some screens for your knee, hip, and ankle, and then we'll prescribe some fixes that will hopefully help improve any failed tests that we found. And then at the end, we can ask questions or go over specific things or scenarios if you want to. And you can stop me at any point and ask a question. So, are there any questions so far? Okay. I brought a little handy knee model. Main structures of the knee are going to be your femur, your tibia, your fibula for the bones, and then the main muscles. There's other ones, but the main ones for the purpose of this talk are going to be your quads, your IT band, your calves, and your hamstrings. The main tendons are going to be your patellar tendon, which is just below your knee, and then your quad tendon, which is just above. And they kind of act together. And then the main ligaments are going to be the anterior and posterior cruciate ligament, or the ACL and PCL, and then the medial and lateral collateral ligaments, MCL, LCL. And then you also have two little shock-absorbing pads of cartilage, the medial and lateral meniscus. So you guys can take a look at this. And then if you look at that, your patella or your kneecap, if you look underneath it, it's kind of V-shaped and it rides in this little groove. And that's important for when we talk about one of the types of knee pain that you could encounter. So the 4 non-traumatic common causes of knee pain are going to be IT band syndrome. See this a lot with runners, track athletes, but even people that are squatting or doing things in the gym. And that, with that type of injury, the pain's usually going to be on the lateral or the outside of the knee. It could also cause maybe like popping or snapping. The whole side of your leg could feel tight. Could affect your hip too, because your IT band goes from down here to here. It crosses both your knee and hip joint. And it's one of those that you wouldn't probably know it's tight until your knee starts popping, or if you lay on a foam roller and it brings a tear to your eye. Second one is patellofemoral compression syndrome. So that would basically be extra pressure pushing down on that kneecap, and that could lead to extra wear and tear underneath the kneecap. It could cause the kneecap to pull to the right a little bit. But where you might feel that is going to be underneath the kneecap, and usually at like the bottom of a squat, or like when you're going to stand up, because that's when the compressive force is going to be the most. Thanks. on that joint. The third one is patellar and or quad tendinopathy. So just use over time, where the quad becomes tendinous right before the patella. You could have pain there. And then if it's down below the kneecap, that would be the patellar tendon. Again, running, squatting, lunging, all those kind of things could do that over time. And then the last one is just poor biomechanics. So you could be performing the squat or the lunge or the thing incorrectly, and that's loading structures in the knee incorrectly. Or the joint itself could be rotated a little bit. So no matter what you do, stretching it, foam rolling, it isn't necessarily going to correct that. And then you could have a little bit of pain or pinching. Any questions now? No? So if your knee's bothering you, you're going to find out that you use your knee for a lot of things, but the obvious ones are the squat, the lunge, jumping, running, and then even anything lateral like skier hops or lateral hops. That may not necessarily cause pain, but if your knee is unstable, that could put you at risk for a bigger injury. In life, anytime you get up from a seated position or pick up something off the floor, but a big hallmark sign is your ability to go up and down the stairs. So if you're in like the population that is maybe looking at a knee replacement, that's one of the things they'll look at is they're like, well, take it as long as you can until you can't tolerate it or until you can't go up and down the stairs, and then we'll look at replacing it. And it seems simple because you're just taking a step at a time, but that could put a lot of pressure on those tendons, the patella. So moving on, we're going to talk about the squat, and it's important to note not everybody's squat is going to look the same. So your femur length, your torso length, the actual shape of your hip joint is going to make a big difference in what your squat looks like. I'll move this over. So my squat is not going to look the same as hers or as yours, and that's okay. They're not all supposed to look the same, but there are certain things that will be universal across the board to do it correctly and safely. And that's going to be being balanced over your whole foot with 3 points of contact under the ball of your foot, outside your foot, and your heel. Your core being braced, having a neutral spine, so your head, upper back, and butt staying in a line and moving together. And initiating with the hips first, then the knees, and your knees should track whatever direction your toes are pointed. So for me, and I've had to play around with this a lot to figure out where I felt most comfortable with the squat. So mine, I have a little more narrow of a stance and my toes are pointed out, but it allows me to get down here easily and I don't have any pain or any restrictions. So if you look at me from the side, my head, upper back, and butt should go down together and they'll rise together. So let's have you guys all stand up.
You want more of a flat back, right? Not like curve when you're aiming towards the bottom?
Yeah, your back should stay neutral, or those 3 points of contact should stay in a line the whole time.
Is it bad if it's like more of like if you're so focused on keeping your back straight instead of like curving over? Is it bad if you're kind of like inverted?
Yeah, so
like this, like this is straight, but like this.
yeah, so a lot of times a cue you'll hear is keep your chest up, and that will actually, not always, but it can cue somebody to do this, and then they're going to be using more of their back muscles and actually arching their back, and then that could actually cause more of a problem. So how do I want to say this? Your chest doesn't necessarily have to be up. It should be neutral. So if you were to glue like a broom handle to my back, and I've had people do this in my office, it just all has to move together And so it's okay if your chest comes forward as long as you're balanced over your foot, and then it should rise at the same time. So let's do like 4 just body weight squats. I'm just gonna take a look and judge all of you. I'm just kidding.
Jacob, you're not doing a squat.
Jacob, come on.
All the way down that stool.
All right, so play around with pointing your toes out, maybe going a little, you all looked like you had a pretty good base stance. Did anyone have pain doing that? You did? You did it too? Okay, you do too. So take note of where that pain is. Was it on the outside of the knee? Was it above the kneecap, below the kneecap, under the kneecap, or was it in your hip or your ankle? And then see if going a little wider, pointing your toes out, if that changes anything for you. Or just sit down, whatever.
Oh, I got it.
Yeah. Does that change anything for you guys? A little better? A little wider is better. Okay, so some of the faults that I'll see, and we already touched on one of these, is your back being rounded or too arched. Another one is, and usually that's gonna be either like an awareness thing. Maybe you don't know what it feels like to keep your back totally neutral throughout a movement. Another big one is the knees coming in. So usually I'll see people start too narrow and they try to go like this and their knees will come in. None of you did that, which is great. And it looked to me like all of your knees were going out. I did see maybe one knee come in a little bit, but that's usually gonna be more of like a hip stability or like a foot stability type issue. Crack, crack, crack. Yeah. Another thing is if you have an ankle mobility issue or if there's pain in your ankle, you may shift to a side because you can't get this knee all the way over. And for me, I have an old ankle injury on my right side that I worked a lot to get this dorsiflexion back. But for a while, that was a big issue for me. And then another one is sometimes people will go down to here and then they tip forward. That's not necessarily a squat, that's more of a good morning. So you're limited in your ankle mobility or your knees themselves, and then you're using your chest to get down lower. Really what you want to see is your hip crease go to like 90 or a little bit below. And that could be a hip mobility issue as well. But some of the things we're going to do are going to touch on that and should help fix it. So we're going to partner up and then we're going to go through the screens we'll start with the knee because that's the easiest. If you look at your knee, it's got 2 ranges of motion. It's got extension and it's got flexion. So to make sure you have full extension, pretty easy to do. Sit on the ground with your leg out. When you squeeze your quad as hard as you can, your heel's gonna lift up just a little bit. So let's have you all sit down. Try that on both sides. So the next thing is getting your heel to your butt easily.
Without a cramp?
Well, if you're cramping, that's because you're probably trying to contract your quad.
I'll cramp here.
Oh, and your hand, yeah, so you're using your hamstring to pull it. So with a partner, so you can do this passively, you should be able to just take your partner's foot, or if you can reach, do your own, and your heel should touch your butt pretty easily. If there's pain, take note of where it is. Or if there's like, let's say your left side's no problem, and then your right side can't get anywhere close, obviously then we're gonna have to work on that side. So the squat or contributing to knee pain, the number 1 driver is gonna be dorsiflexion. So when you point your toes, that's plantar. When you pull your toes towards you, that's dorsiflexion. This is gonna be the ability of your knee to go over your toes. And if you can't do that, like if it feels stuck and you're hitting a wall and you can't go any further, that's when you're gonna get a weight shift or you're gonna put more pressure somewhere else. So come on over to the wall here. We should be able to be about 5 inches off of a wall with your foot totally flat, barefoot. You guys are all barefoot. I'm cheating because I have shoes on. Keep your heel down and touch the wall. So,
Getting down there.
yep.
Oh, good Lord.
So, if your toes are on the line, you're more like 4.5 inches. If your toes are off the line, that's the 5-inch mark.
To do this?
You can do it standing up too. That's
My
fine.
heel's supposed to stay down?
Your heel's supposed to stay down.
Well, as soon as I go here, it lifts up.
Yep. So you don't have to kneel down, you can stand too and just try to get, yeah, you got it. Okay. So that's a pass test, that's good. So if you're like looking at what could be affecting my squat or what could be causing or contributing to my knee pain, if you pass this test, you can kind of take the ankle off the plate. So it's not your ankles. And your knees were coming in. So that already tells me what it is. It's a hip stability issue.
Babies.
Babies, these damn kids.
Can't use that excuse for everything.
Pregnancy.
Me and you don't get a say in this matter. We got a nod. All right, so we'll come back over here. Now we're gonna go, the hip is a little more complex. It's also a primary driver of the squat. So we're gonna do 3 different tests for the hip, and you will need a partner for this. The first thing we're gonna do is test the strength. There's other muscles and different ways we can test it, but a simple one that we're gonna do is you're gonna lay on your side, you're gonna lift your leg up, and your partner's gonna push down for like 5 seconds. And if it like, if you lose it or it feels weak, gotta work on that side. We'll test both sides. So let's have you lay on your side. Partner up, partner. Looks like you guys are all. Did you do both sides? That one's, yeah, so, okay. So this is a good example here. Her right leg is at maybe like, I don't know, 50 degrees, a little more than 45, but if you look at this one, it almost goes parallel to the floor. So for her, she needs to work on the external rotation of that. Yeah, that too. Yeah, so your left hip, external rotation is something to work on. Did you have knee pain on that same side or no? Okay. All right. Next one we're gonna do actually gives me a lot of information. So you're gonna sit at the end of the bench and then you're gonna lay back and you hug your knee like this. Lots of parts to this. You should be able to get your knee up into your chest easily without pain. This other side should hang freely. If this leg extends or comes up or goes like that, if it extends, it's your quad. If it lifts up, it's your hip flexor. If it goes out, your IT band. If it does all of them, then it's all 3. So come on over here and we'll do this test. We can kind of go one at a time since it's a smaller group. And then after this, we'll kind of do all of our little fixes. So lay back.
That's as far as I can go.
Is there pain here in your hip? Looks like the knee's extending a little bit, quads, and I remember you couldn't get your heel to your butt.
That is
Right?
correct.
So try the other side.
2 inches.
That's right.
Or an inch.
So working on your quad mobility is going to be helpful. And again, on this side too.
At least I'm symmetrical.
Come on, that's true. What I'm going to do to try to correct some of the mobility issues, if you failed the wall test, which it seemed like most did, I can only pass it with my left. My right is like a ½ inch different. So I'm always working on my right side. What you're gonna do, all your shoes are already off, is you're going to put this, take those off, right below the crease of your ankle, like that. You're gonna step out, Then you're gonna kneel, and you're just gonna kind of let the band pull back into your ankle, and then you're gonna go outside, and I just got a huge pop, which feels great. So you're gonna have your knee go to the outside of your toes, middle of your toes, inside of your toes. And you're just gonna kind of work through that for a minute, let's say, a minute each side. So come on over, let's give it a shot. I only have 3 bands, so we can take the next station we're gonna do foam roll. So for the purpose of this talk, I'll kind of go through this while you're still doing it. We're gonna focus on our glutes, our IT band, quads, and our calves. And this is something that I do pretty much every time I go to the gym. It doesn't have to take 15 minutes to foam roll. You can do like your whole lower extremity in just a short amount of time. But I'll usually start by sitting on it, and I'll pick a side. I'll roll out my butt. Then I'll switch, and I'll kind of like drag my leg across it. Oh my. And if you haven't done this, this actually hurts, but it's like a good hurt. And it gets easier. So usually when I tell people to do this the first time, they almost cry and they don't want to do it. But the more you do it, the better it gets. And then I'll switch and I'll kind of army crawl across it for my quad. And then when you get to the calf, just kind of support yourself with your leg and hands and roll it out. Okay? So grab a foam roller. There's one more over here. I'll grab that. Going to create laxity in the joint, which could lead to an injury. So.
I only ask because, like, from Cognitive football's perspective, and coaching, we do the standing, like,
Yeah.
you know, this one, I know that when we have them sit down, and we try to do the,
Yeah.
you know, moving ones, but in the beginning, we start out with static stretching.
Yeah. I would try to shift that to the end. So I'm sure you do a lot of dynamic movements as well.
After the static.
So like a version, instead of holding this, a version of that would be like butt kickers, right? You're still getting the same kind of stretch, but it's dynamic, and it's gonna get blood flowing to the muscles. So that's where I would. Next thing we're gonna do, we'll do some just static stretching. So we're gonna do pigeon pose. You're gonna go like this. Try to get it close to 90 degrees. If this is a problem, you can also do it with a box. You could do it elevated like this. That might be easier. And you should feel this kind of like around in here. And you can play around with the angle of your torso or like your chest. You can kind of shift your weight either way to see where you feel the best stretch. Next one we're gonna do is a runner's lunge. So your shin should be like vertical and your hands are both gonna be on the inside of that foot. If you're really cool and flexible, you could try to get your, and I can't, but you could get your elbows to the ground maybe. And here you're gonna feel it in your hip flexor. You should feel it like way up.
So is this leg supposed to stay at a 90 or are you moving it forward?
If it goes in front of it a little bit, that's okay. But yeah, shin relatively vertical is gonna load the hamstring a little better. And then something that I'll usually add to is just some thoracic rotation. So I'll reach through and then I'll reach back. So I'll do like 4 of those and then we'll switch legs. Is anyone having, so try to get that knee back further. Yeah. Is that hurting your knee?
No,
Okay.
I just don't have any stability.
Oh, I see. Okay. Next stretch we're gonna do a kneeling lunge. So you'll just pick whatever way you want to kneel to start. You're gonna lean forward. You gotta get your knee behind your hip, and then you're gonna lift your chest up. You should feel this in your hip flexor. If you don't feel it, reach up and lean towards the your stabilizing knee. That way. So, yep, up and then that way. Now you should feel it in that left hip.
I felt it. Oh, I get, yeah.
Yep. Is there any pain with this? If this bothers your knee, there are other ways to stretch out your hip flexors that I could give you. But this one targets it really good. After 30, 40 seconds, switch sides, same thing. Get the knee behind.
Can't get down.
What's that?
This side I can't get down at all and stretch. The knee won't let me.
You could try doing it standing. So try standing up. Keep that right leg straight. Take a big step forward. Square up your hips so you're facing like this way. And then lean back. Reach up with your right. And then lean to your left. And you should feel it like in the front here. Is couch stretch. So if you put your foot up on a box or a wall, like right now my knee is underneath my hip. So this is primarily getting my quad, and I do feel it. But if I were to like lean forward, and then try to lift my chest up, that'll get your quad, but also your hip flexor. So that's a good stretch too.
I can stretch that way, but that's.
All right, and last thing we're gonna do. This is gonna be good if your knees collapsed in, or if you had trouble with the, I'll grab one too for myself real quick. So if you had trouble in that, in that side lying, yeah, you can handle it. Sorry about that.
No, it's okay.
I'm new here. I didn't know what the weights were. So yeah, if you had trouble with that side lying resistance, or you squat and your knees and feet collapse in, this is gonna be a really good one for you. What we're gonna do, you're gonna put the hip circle, this is tough on the leg hair. Oh baby. Okay, you're gonna put it just above your knee. We wanna give ourselves some space, because what we're gonna do, I call them monster walks. I don't know. I'm sure they got all sorts of names, but we're gonna make a box. So we're gonna do, and once you get tension on this band, like in an athletic stance, you wanna keep the tension. So when you step, you don't wanna like lose it and walk. So make sure the pole's out of your way. So let's go this way to all of your right first. And you're gonna do 8 steps to the right. Maintaining that tension, go for it. And then after you got 8 steps to the right, you're gonna step forward 8 times, and you wanna feel like your feet are on train tracks, so you're, again, not taking tension off that band. 8 steps forward. Maneuver around the obstructions. After that, now you're gonna go 8 steps to the left. Should have maybe lined up, and that's okay. And then after you do that, now you're gonna do 8 steps backwards, keeping tension on the band the whole time. So where you should be feeling this is in your glutes, okay? Now, once you're done with that, you're gonna stay right where you are, tension on the band. You're gonna do kickbacks, 10 of them. Try to balance if you can. Do 10 on each side. And really focus on squeezing your butt cheek. After you got 10 on each side, is this a challenge for anyone? Is it burning your, like, are you feeling it in your glutes? Yeah. So now, once you've done your kickbacks, you're gonna get into your squat stance, tension on the band, and you're gonna do 10 slow squats, keeping your knees pushing out that whole time. How we doing? All right, so that was our last little fix. There's a lot you can do to try to add hip stability, but you should have felt this firing up your butt.
Oh, yeah.
usually like before a squat day or if we're doing lunges or something like that, I'll do this and I'll maybe do like 3 of those boxes and I'll do like twice through the kickbacks and the slow squats. Oh, so before we put them all away, let's have you retest your squat and see if you're still having pain where you were having pain. And what I want you to think about doing is screwing your feet into the ground. So what that means is you're going to create tension and turn on your glutes and then think about pulling yourself into the bottom position and standing up while you force those knees out. And does that feel different? Is there still pain?
Yeah, but
That looked better.
I just have to concentrate on it.
Yeah. How's that for everyone else?
good, definitely better with a little bit outward stance.
Yeah.
Finding my stance is definitely
Yep.
better.
Yeah. So like I said, your specific anatomy is going to change how the squat's going to look. And that's okay as long as the back is neutral, the knees are going out, core is engaged, and you feel balanced over your foot.
So what's your take on broad jumps
Broad jumps?
for the knees?
I think it's fine. What's the,
I'm trying to convince Brittany and Zan that broad jumps are terrible for the knees. Because what they have is like this week they had to start from that end, broad jump all the way to that end.
oh, okay.
Yeah, I do mine.
So they probably hurt your knees when you land. Yeah. So when you do like a broad jump or something like that, this right there, when you catch yourself and you land is, I mean, that's pretty explosive power on your quad. So, yeah.
It's all quads. It's
That is the takeaway. It's your quad or IT band in a lot of the cases. So working on your hip mobility, ankle mobility, and hip strength, glute strength is really what's going to save your knees because, like I said, this is a hinge joint. If your knee's hurting and you didn't tear something, like you didn't do something traumatic that you know, oh, this is what I did to my knee, then it's probably not your knee's fault. It's probably your ankle's fault or your hip's fault or something else. So you kind of have to look elsewhere.
What's the easiest way to strengthen the muscles around your knee to help support your knee?
Supporting the hip is huge. So those banded walks we just did, any glute specific exercise, balance exercises, so doing like single leg RDLs, hip airplanes is another one where you kind of do an RDL and then you rotate open. Oh, that takes a lot of stability in your hip and balance. And also, I mean, strength in your foot to be able to do that.
That's part of my goal of being here is to strengthen everything to support the knees because I'm
Yeah.
prolonging the surgery as long as possible.
Yeah. Yeah. So you can do, I can email you more specific things because your scenario is a little different. If you actually have cartilage damage in there, these things that we talked about are going to help, but you might need to do,
I was told it's
Specific.
and I'm divoting, so my goal is to
yeah.
prolong surgery.
Yeah.
Let's get the surgery. I'm like, well, no.
Yeah, even like single leg squats to a target can be really helpful, or step downs. So if you're on a,
Lunges, I can't get down. They, everyone's like going all the way down. And I'm like, yeah, no, that's all I get.
yeah,
I'm just not getting. I can't get down.
yeah. There's a lot of things that we can talk about there, but also just adjusting your knees. So right now, well, you can kind of see it on here. Usually what will happen is the inside of this joint becomes more narrow and rubs, and that alone can cause, changes in the function of the knee. So adjusting it can kind of reset that. It's not going to regrow cartilage or anything, but it'll decompress that area that's being irritated. Another thing would be electromagnetic transduction therapy is good for arthritic conditions. So that would be another option. Yeah. Any questions?